Together we achieve victory over heart failure.
I am Dr. Dhiman Kahali. I am the Director Interventional Cardiology, PM Birla Heart Research Center. I am also a Senior Vice President of our august body, Cardiological Society of India, also Course Director of National Intervention Council, and I was the next Chairman of National Intervention Council, and I hold several others. So thank you very much for asking me to come in this podium for this podcast. And first question is that in majority of patients grappling with heart failure, surprisingly, young individuals are more affected. And why does it mean when a doctor tells you what you have heart failure? So heart failure means the capacity or the contractility of the heart is not sufficient to pump the blood and the nourishing elements and also oxygen to the periphery, to the different tissues of our body, and it is insufficient to carry out the activity. So this is the definition of heart failure. Now, what is meant by ejection fraction? Ejection fraction, frequently we use this term. Now, ejection fraction is a measure of the contractility of the heart muscle. Now, the heart muscle, normally, what is the ejection fraction? It is 55 to 70% in a normal male individual. In ladies, it is told to be little low, 52 to 70%, normal. But normally, we see ejection fraction between 60 to 70%. And according to that, the heart failure differs. There are 4 or 5 varieties of heart failure. First is heart failure with reduced ejection fraction, where the ejection fraction is below 39. Then comes the mid ejection fraction, that is 40 to 49%. And next is heart failure with preserved or intact ejection fraction, that is 50 to 65% or 70%. That is preserved ejection fraction. There is another entity which is known as heart failure with improved ejection fraction, which means that the ejection fraction was lower than 40% at some point of time, but with treatment and with time, the patient has improved significantly and the ejection fraction has come up from 35% or below 40%, whatever it is, maybe sometimes 20%, to more than 40%, sometimes from 20% to 65%. This is a huge journey, but frequently we see people are doing this journey and they had a severe LV systolic dysfunction, but it has improved to 45%. And another fifth entity, this is the latest edition by European Society of Cardiology, that is the heart failure with normal ejection fraction. I don't know what is the difference between preserved ejection fraction and normal ejection fraction. It must be not these individuals between 50 to 60%. They must be 60 to 70% ejection fraction, and they are called as heart failure with normal ejection fraction. Now, the second question brought to me is that why we Indians have so much of heart failure? Okay, we Indians have the heart disease about 10 to 15 years before the onset of heart disease in the Caucasians, that is the Western hemisphere patient, that is from advanced European countries and East European countries, US, Australia, New Zealand, etc. We get the disease about 10 to 15 years ahead in comparison to that, because we had a lot of hypertension, diabetes mellitus, obesity. Many of us are smokers or consume tobacco in some other form like quinine, oral tobacco, or pan parag, pan masala, so on and so forth. So these are the reasons for early heart failure in our country. And 1 in 4 of us, male or female, we are prone to develop heart failure at any point of our time. And diabetic patients have more propensity to develop heart failure, and ladies are less vulnerable, 1:3, and males are more vulnerable, 1:2. But both are, I should tell, equally vulnerable. And diabetic patients are more of heart failure, and those are more severe of heart failure. Now, what are the signs and symptoms of heart failure? Very important question. Signs and symptoms are the patient is waterlogged in many a times when they are untreated, decompensated acute heart failure. The patient is dyspneic, orthopneic, means whenever he lies down, he gets dyspnea or shortness of breath or difficulty in breathing. And whenever he sits, the breathing difficulty comes down. And then it happens in the middle of the night. That is known as paroxysmal nocturnal disease. The patient goes to sleep without any symptoms after sleeping well for 3-4 hours. In the midnight, in the deep of sleep, say at 2:30, 3 o'clock or 3:30, the patient gets up from the bed, panting for breath, asks everybody to open the windows and doors, and once that I haven't got any oxygen, oxygen is not coming, I am feeling suffocative. That is known as paroxysmal nocturnal dyspnea, and that indicates that the patient has advanced heart failure. And what are the symptoms of this disease? The symptoms are very evident: shortness of breath, palpitation, confusion, tiredness, easy fatigability, weakness, lack of appetite. There is edema or swelling of the body, swelling in the legs, facial puffiness. Sometimes there is water accumulation in the abdomen, known as ascites. Sometimes there is pleural effusion, which makes the patient very much dyspneic, when shortness of breath is there, and the patient is highly symptomatic. Now, you are telling that I'm telling that this is okay, of course, a severe disease. And you know why we are bothered about this disease, that at 5 years, the mortality is as high as 50%, which is more than many of the dreaded cancers. So it has got a high fatality rate, even after the commencement of very good foundation therapy with 4 drugs like beta blockers, SGL2 inhibitors, mineral receptor antagonists, and the 5th one is RNA/ARB/AC inhibitor. So we can prevent this disease by treating all those factors which we have told, that we have to treat hypertension, bring the blood pressure to normal level. If a patient has a normal blood level, even after 50 years of hypertension, we find that the patient is going very well and he hasn't got any problem, no heart failure, nothing whatsoever, no ESRD, no end-stage renal disease. So the patient is fine. Now, there are 5 golden rules which we can follow to return the favor. Early detection of heart failure through regular examination of the patient, elucidating his signs and symptoms, and doing an echocardiogram, ECG, X-ray chest, and some blood tests. Like NT-proBNP is the sine qua non for diagnosing heart failure. In 99.9% of the patients with heart failure, the NT-proBNP is very high. Dietary adjustments to maintain heart health. I don't want to tell more about heart healthy food. You can teach me, all of you can teach me about good food which are good for the heart. Incorporating daily exercise into our routine practice, that is some 30 minutes to 45 minutes of brisk walking or jogging, who are young and who hasn't got any heart disease or severe hypertension, they can go for jogging also, and other asanas, exercises, etc., etc. Dietary adjustments are also very much required, and practicing stress management technique is equally instrumental in preventing heart. Similarly, quitting alcohol and forgetting about them totally, instead of becoming occasional drink. Tobacco and smoking, we should avoid all these 3 things so that the patient is fine and he doesn't develop heart failure. Lastly, what comes next after a heart failure? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker insertion, an implantable cardiovascular defibrillator, or heart valve repair or replacement, all these are good treatment options for the treatment of heart failure. As I told you, apart from these device therapies, there are 4 foundation therapies which are very good, and we have got very sick one. Apart from these 4 foundation therapies, restriction of fluid, restriction of salt, we have got centrally acting agonists like clonidine and other drugs, moxonidine, etc. They work well and they reduce the blood pressure. So, if we can treat the causes of hypertension, of heart failure like hypertension, diabetes, hypercholesterolemia, hypertriglyceridemia, high LPL level, high ApoB, etc., and quit alcohol, stop smoking, and taking alcohol products and exercise daily. Not very vigorous exercise is required or aerobic exercise is required. Some sort of exercise which involves taking the heart rate to 135, 140 in suppose 60-year-old gentleman and keeping it on, then I think you can get rid of this heart failure syndrome and the signs and symptoms thereof. Thank you very, very much, ladies and gentlemen, for your patient hearing. So my message is that kindly don't panic about heart failure. Do these simple things, these simple lifestyle measures, that is exercise, good diet, nourishing diet, less of worries, anxiety, and if somebody has high blood pressure or high cholesterol or diabetes, please treat them adequately. Thank you again.